Rhinoplasty. Rhinoplasty is one of the most frequently performed plastic surgery procedures in both men and women. With this procedure, it improves not only the aesthetic appearance of the nose at several points, such as the tip, the dorsum, and alar rims, but can also improve structural deficiencies that create breathing problems, whether genetic or caused by illness or injury. The best way to understand the procedure of a rhinoplasty is to recognize the internal structure and anatomy of the nose. The nasal dorsum has two portions, a superior upper half made of bone and an inferior lower half made of cartilage. The dorsal hump is generally a mixture of both bone and cartilage. The nasal tip is composed of two cartilages, one on each side, which determine the shape and position of the tip. The nasal septum is an osteocartilaginous wall that divides the right and left side of the nose, stretching from the columella in the anterior portion through to the posterior part of the nose. Rhinoplasty is done under general anesthesia, during which IV anti-inflammatory medications are provided. In general, there are two surgical techniques used in rhinoplasty, which differ only in the way incisions are placed. With the open technique, one small incision is placed outside at the bottom of the columella, and two internal incisions are placed in each nostril. The closed technique has only the two internal incisions on each side of the nostrils. The technique is determined solely on what is best for each patient. With a rhinoplasty, it is necessary to modify some internal structures that shape the nose. In order to obtain a well-defined tip with good projection and support, adjustments are made to the structure, the shape, and position of the cartilage on both sides of the tip. This can be done through different techniques, such as removing small portions of cartilage at specific locations, which require permanent sutures, or in some cases, using graft cartilage that improve the shape and the structure of the tip. In those patients who present with irregularities or dorsal humps, a special technique is utilized which smooths the nasal dorsum, avoiding unnecessary surgical fractures that commonly promote bruising and swelling. Many patients often have wide dorsa that require osteotomies to obtain a thinner and better defined dorsum. This is a particular concern for women who prefer a thinner and more feminine nose. In those cases where it is necessary to use cartilage grafts, they are taken usually from the nasal septum. In a small percentage of cases, they are taken from the ear. At the end of the procedure, all incisions are closed with absorbable sutures. A light splint and micropore tape are placed to protect the nose and help mold the new nasal shape. Generally, both are removed between 8 to 10 days post-surgery. In most cases, nasal tampons are not necessary, as the splint and tapes allow the patient to breathe through the nose immediately after surgery, eliminating the need and discomfort of mouth breathing. In order to minimize bruising and swelling after surgery, we prepare our patients with homeopathic medication, which is started 3 to 4 days prior to surgery.